Good morning, everybody. So thank you all for your participation. Today we will discuss how to learn from the experience, how to spread it to other countries and to improve it. So I invite all the audience to ask their question in the chat, and the moderators will try to ask them. So enjoy your session. Thank you.
Thank you, Nathalie. Thank you, everybody. Good morning. Very happy to have you again with us. So Elio and myself will try to moderate this roundtable that I'm sure will be very interesting and very important for the EGEA program. Before starting, what is important is to know who are around this table, and I will ask the different members to present themselves. We have people from the WONCA Society, and I will ask first Anna to present herself and maybe also to tell some things about what is WONCA for the audience. Anna.
Thank you. Thank you and good morning from Oslo. My name is Anna Stavdal. I'm a family doctor and university teacher at Oslo University. I'm also the president-elect of WONCA World. WONCA is a global network for family doctors. We have members in 131 countries all over the globe. We are working in the fields of research, professional development, education, and first of all, we are clinicians. More than 500,000 members. We have a strong European region, and I'm happy to hand over to the chair of our Young Doctor Movement, Kasia Nessler, to introduce herself.
Kasia, the floor is yours.
Thank you very much. So good morning. My name is Kasia Nessler. And I come from Poland. I am a family physician working on everyday basis in a family medicine practice, having kids and having adults as my patients. Also, I am a university teacher. I work at the Lyon University Medical College, where I am responsible for family medicine training for the students, for Polish students, but also international students that we have at our university. And last but not least, I am also a president of Vasco da Gama movement, which is one of the WONCA Europe networks, where we are having a network for the young and future family doctors in Europe. Thank you very much.
Thank you, Kasia. And Raluca, could you present yourself?
Hello, yes, thank you, Martin. I am Raluca Zoitanu. I am a family doctor as well in Bucharest, in Romania. I've been a past board member of the Vasco da Gama movement and of the regional part of WONCA in Europe. Currently, I'm the president of the Union of Family Doctors here in Romania.
Congratulations. So we have also members from ECOG, and I will ask Daniel first to present himself, as he was a speaker yesterday, so I think the audience know him, but could you, Daniel, explain what is ECOG and present yourself?
Thank you. The European Childhood Obesity Group is a society with a 30-year history in a quest to fight childhood obesity. It has one major goal, and that is to translate research into daily practice. So by different means, we try to pursue this goal. You might want to have a look at our website. You can see very recently published e-modules together with World Obesity Federation. We have an ebook that has been downloaded close to 1 million times, dedicated to childhood obesity. And there is much more going on, including a very recent and actual series of webinars. So thank you for inviting us.
Thank you. Marie-Laure, can you present yourself?
Yes, I'm Marie-Laure Frelut from France. I'm a pediatrician involved in the field of clinics, working in the beginning with a childhood obesity group, where I try to bring some input in terms of teaching modules and developing new teaching ways with a free ebook and so on. And I'm very glad that we get a wide range of members from all generations, so that the job can go on.
Very good. And finally, for ECOG, Andrea?
Yes, thank you. Good morning. I am Andrea Vania. I am from Italy, and I have been recently involved with the university. I was the teacher there. Well, of course, I am a pediatrician as well. And as for the ECOG, I have been one of the previous presidents, like Mary Laure herself and like Daniel presently. I'm still involved in the research and in collaborating with several scientific societies. First of all, the ECOG and the learning modules that the ECOG is preparing, and so I think that's enough. Thank you.
Thank you. So finally, as the program would have not been possible without a scientific committee, we have a representative of this committee, Jean-Michel Lecerf. Jean-Michel, could you present yourself?
Thank you, Martin, for inviting me to this Congress. I am effectively member of the scientific board of EGEA, and I am also member of the scientific advisory board of Aprifel, which is a French agency for fruits and vegetables since 20 years ago. My activity is double. I am medical doctor in the University Hospital of Lille. I am endocrinologist and nutritionist, and I am well involved in metabolic disease, obesity, diabetes type 2, and nutritional disease. And I am head of the nutrition department of Institut Pasteur de Lille since a long time ago. And, we conduct studies in nutrition, and I am very interested to improve the health of the population through increasing consumption of fruits and vegetables. It's quite difficult, but I hope we will success more and more. Thank you.
Thank you, Jean-Michel. So just to explain to the audience, the round table will be about how to learn from the experience of the program. Yesterday afternoon, you have the explanation of what has been done, what was the program. So we want to learn from it, and also we want to know how to spread it better and how to improve it. So there will be a discussion with the members that has been presented there, but also we want to have your feedback, and we are waiting for your question by the chat. So the first question is a general question to our members of the round tables here about their involvement, their deep involvement in this program. And I want to know, we all want to know what was exactly their commitment in the program, and what was their feedback from them, and if this program has some impact on their practice, usual practice. So it would be very interesting to have the feedback from the different members. And we have selected from the WONCA, the general practitioner. It's very important to know how they feel about what they feel about the program, how they have it in their usual daily practice. So first, I will ask Raluca to tell us how it works for her, and what's the program, what she has done in the program, and what the program has done for her. Raluca.
Thank you, Martin. WONCA has been involved from the very beginning. I think we met 2 years ago in 2018 in the EGEA conference in Lyon. It was a very nice time. And we participated then in the conference through interventions. Of course, it was a 2-day conference and a great occasion to meet with colleagues who we don't usually meet with. We are in our trenches, doctors, and even through doctors in our respective specialties, nutritionists, researchers who are not doctors, and behavioral specialists. And it was extremely, it raised our awareness of how complex nutrition is and nutritional advice is. Because we, of course, as general practitioners, we often discuss with our patients in our practices, in our consultations, about how important it is to eat right. And especially when we are asked questions about if they can get some supplements, some multivitamins to boost their immunity, especially now in COVID times. And we often say, well, in fact, you should eat right, fruit and vegetables, your 5 a day. But not every country has an awareness campaign like that or an educational campaign like that. So it was important to learn from our colleagues how exactly to give this message and what data to use, what resources to look at. Then we were involved in verifying, in writing these practical sheets, which are again very, very useful in our practices, because as doctors, we have to learn so much all the time. Medicine is changing. The quantity of information is doubling every 5 years. And this was a soundbite I heard a few years ago. So now I imagine that the quantity of information is doubling every less than 5 years. So there's simply not enough time to always look and always search for information, especially about nutrition, which doesn't seem exactly like the most important part of the consultation or of the recommendation you make to patients. But it should be more than drugs, and it's important to know where to look at. And it's been a long process. We created these sheets together for 2 years, and we gave the family doctors, the general practitioners' perspective on that information, and then our colleagues in ECOG verified it and gave their impression, and you in the scientific committee and everyone at Aprifel. So I think it gave us a lot. It was a very good project and very useful one. And I can speak for myself, for my practice, but also feedback I received from colleagues, because we disseminated these sheets among our colleagues through our newsletters. If you read about it more and more, it does make you more aware that you should speak more about consumption of fruit and vegetables to patients, and to give them accurate information, because there are a lot of myths going on, especially in some diseases. For example, in cancer, there's a myth that you shouldn't eat fruit, you shouldn't eat sugar. And it's important to find the resources, because many patients now have a lot of information themselves with the help of internet. And these sheets were good to use in the practice to show patients. We had them printed and showed them some information right there. Now with COVID, a lot of the consultations moved online, but again, we can send them links, and we can give them resources online through email or through teleconsultations. And to some who still come to the office, we give them in the office. So yeah, it was a very, very nice experience, and we're happy to have been involved in it.
How do you use the sheet in practice? Do you speak about food and vegetables intake, and then at the end of the consultation give the sheet? Do you read the sheet with your patient? How do you use it?
Well, it has to be very personalized, because patients' level of information, level of interest is different, and we're in a fortunate position as general practitioners to know our patients very well and know what works. So to some of them, yes, I give the sheet, although it's a sheet for the medical professional, it's not for patients. But still, you know, some of them want to know everything a doctor would know. To others, I just give some information and then I show them that it's also there on the sheet. So I'm not just speaking from you know, my experience or my it's not just my ideas. It's something that actually the scientific community or the medical community and the fruit and vegetable professionals agree on. So yeah, it depends on the patient really and on the time we have, because as we were mentioning in one of the sheets, often we don't have enough time to speak as much as we'd like about nutrition, and that's where a good collaboration with nutritionists matters, and for health systems to, you know, include the big team of primary care and of health in their in the systems, in the health systems, and not be limited by money, by you know, how much you can pay to go to see a nutritionist.
Yeah, and you have feedback from your colleagues that improves their knowledge in nutrition and their self-confidence to answer to their patient. Do you have this kind of feedback?
Yeah, again, it depends, because you know, I think general practitioners are the biggest represented specialty in medicine. We are the most yeah, so we are 1/3 or maybe 1/2 of specialists in medicine in many countries. So everyone will have different interests. We have family doctors who are also part-time nutritionists. But as a general rule, yeah, colleagues were happy with these sheets, because, as I said previously, it gives us access to information quickly. We don't have to search for it ourselves, and it's not just any information on the internet. It's information which is curated by WONCA, by ECOG, by you know, the university in Lyon, and yeah, so it's good information.
Very good. Then we can move to have to get the pediatrician advice. Maybe Daniel, you can answer to this question about your involvement, the use you have done with the sheet, and so on. Thank you.
So very similar to what Raluca just mentioned and summarized for WONCA, ECOG contributed to the IGEA meeting in Lyon in 2018. It was just fantastic to be part of that meeting and touch base with people that we would not be meeting in our own meetings. So this has been a very, very important meeting and stimulus. From there on, we made a contribution to these sheets, and this was not just simply writing a paper as we as researchers would be doing, but with the dedication to summarize relevant information with an evidence base for our colleagues. And I think we have gone quite along. It has been successful, and there are still steps to be taken. In terms of dissemination, this is, I think, where there's still room for improvement. I have been using the sheets together with other information at my own university, at my own department, teaching my colleagues, using it as a basis, and that is something we can be and you can be proud of. So the collaboration of different societies consisting of different disciplines is really fruitful.
That's good. That's good. And in your practice, your own practice or the practice of your other pediatrician, maybe other members from ECOG could answer, are these sheets used? Of course, you, Marie-Laure, and also Andrea, you are used with nutrition. So maybe the sheet was not very useful for you, but you should have feedbacks from others that have not the same level in nutrition than you have. So do you think they were happy with that? Do you see some limitation? What?
Yes, as you were saying, in my practical practice every day, the sheets are, I mean, they summarize what I'm already doing and I do every day. So it is not a big improvement. I'm sorry to say that, but it is the reality, I mean. But it is because of my field of expertise. For other people, for other colleagues, and for the young post-graduation students I had, they have been useful, as Daniel was saying, and they help to raise a little bit their awareness about nutrition. This is a point that I think we will discuss later, maybe with the third questions that you raised at the beginning. So I think we will enter better in that point after.
Okay. And Marie-Laure, you want to comment for the practice?
Well, I'm facing the same situation as Andrea and Daniel. A problem we have in France is that also we are aware that nutrition is very important. There are nowadays a very small number of pediatricians which are working in either in a hospital or in a private practice. And that's a general trouble, so that we don't know to whom send the information, because we are so few now working that we have a limited way of transferring information, and that has to be really improved in France. Also, pediatrician or GP working in the field in pediatrics, because GP are now taking care of about 2/3 of the children in France, need to be connected to such a network. And we need to get out of the strict field of pediatrics just to let information be known from everybody.
Does the representative from general practitioner want to comment that? I think it's very important to raise, Marie-Laure, because there is so few people that are working in pediatrician, so most of the time the family doctors that have to take care, and the level of knowledge that a general practitioner has to have is so important. So does the sheet will help, the pediatrician version of the sheet? I don't know who wants to answer, Raluca, Cassia, or Anna. Because that's a problem.
I would like to comment on that, because when I listen now, I hear this image of the best being that treating children and giving advice to children should be given by pediatricians. From the perspective of family doctors, we are covering the whole spectrum, and we have one advantage, and that is that we often know the family. We often know if we are continuously providing our population, the same population or community with healthcare services. We also know generations, we know family, we know background. So I think we should look more into how we perceive each other and each other's roles, and this goes back to training. I know there's a colleague of you, a pediatrician. Is it Joe Spencer? I think in UK, who had a very interesting project with training pediatricians and family doctors in the same environment, having family doctors into the hospitals and the other way around. That way we can develop a common understanding on how to convey the messages. To at least me personally, and I think I'm in line with most health system thinkers. It should not be a goal that every child has its own pediatrician, but only each child should have his or her own family doctor, and then a pediatrician when the family doctor can't deal with what's at stake. So this to me, it alludes to a bigger discussion about roles and how we see the stream of information and help coming out to our communities. It might be controversial, but then again, I'm very happy to discuss this.
I think it's very important, and maybe it's a part of the second question, but it's important to speak about. So we have the different actors. We have the pediatrician, we have the general practitioner, but you have also the nurses, the dietitian, and so on. So we need to discuss the whole landscape, and that will be important for the pursuit of the program. Who to refer the sheet or to devote some sheet to a specific others. So what do you think about the help that could be done by the nurses or by the dietitian? And I know there is a lot of dietitian in the audience, so they want to know what will be their role.
Maybe this is to you, Kasia, but as I now throw myself into the discussion, I think we have the same basic question here. The team, also in primary care, is extremely important. But we have to be trained and work in accordance with the same values and the same perception of how do people learn? How can we reach them? Because the more professions you introduce into a team, and you say, the more the merrier, of knowledge. I'm not sure that's right, because that can also leave people and patients in confusion, because they are getting different and competing messages. Mm-hmm. So it's again about training and understanding the mandate. Who are we together? And then we can utilize, we are more than the sum of one and each of us.
Very good. Somebody wants to intervene?
Yes, I would like to comment on this. I think this is a really important discussion. And one is about the roles. But before we go to the roles of who is doing what in taking care of children, I think it is important to go back to the training aspect. And I like your idea, Anna, of exchanging training or having common platforms for training, both for GPs and pediatricians, and then also include other disciplines. So this is something that we have been doing locally, and it has been so fruitful, because many of the GPs in our area, actually all of them, received their training at our hospital, all of them, 100%, close to. And so we know ourselves. And if we then meet on a basis of every now and then, we meet 4 times a year for different training content. And one of the recent trainings was on nutrition for children. And that was really fruitful. And what we actually did was to use the sheets that we developed here together with other material and used it as a basis. So the exchange between GPs and pediatrician is really important, irrespective of the situation in the different countries that we have in Europe.
Okay, so I think it's a lot of ideas about the future of the program. I think it's very, very important. So maybe to conclude this first question of the program, I will ask Jean-Michel Lecerf, as on behalf of the scientific committee, to have his feedback on what has been the program for him, and what lesson from the program at the moment.
Thank you very much, Martin. Yes, I was implied in the revision and the consumption of the sheets, and what I would like to say is that I think health professionals and particularly general practitioners are very important for prevention and education of the population. They are key players, and I think it's very important to give them good tools. And medical practitioners are in difficulty for nutrition because they receive a lot of information, a lot of messages which are coming from many medias, and it's very difficult for them to have the good information. And I think in these sheets which have been proposed and done for this program, it's quite good because firstly it's practical advice and practical tools, because medical doctors have no time for explain to the patient a lot of things, but the confidence of the population, the confidence of the patients for them is very high. In some studies, we have shown that 95% of the patients trust in their general practitioners. So when the medical doctors give an advice, it's very it has a very good efficiency. So I think these sheets are very useful. And what is important, I think, is not to say always to the patient to improve their fruits and vegetables consumption and to improve their nutrition, because everybody have learned about, have heard about that. Which is important, it's to explain why we have to improve our diet and why we have to improve and to increase our fruits and vegetables consumption. And I think in these sheets, it's the good matter of the sheets is that we explain what is useful, why it is useful, how it is able to improve our nutrition, and how it is able to improve our health. So I think these sheets are quite original and a good mean to give good answer to the patient. We know that during the medical studies, the time for nutrition is very, very small. Actually, it's better, but 10 or 20 or 30 years ago, for the older medical doctors, it was very, very small. So I think with these sheets, we give a good information, and moreover, we give a global information, because we don't eat only fruits and vegetables. We eat a lot of foods. We eat meals, and so the approach is quite global and quite realistic, because it gives practical advice, and I think that for the patients it's it's quite interesting and useful.
Thank you, Jean-Michel. I think you're right that the patients are confident with their general practitioner, yes, much more than the general practitioner himself is confident in his knowledge in nutrition. And that's that's the fact that in primary teaching, there is very few things about nutrition in France. I don't know in other countries, we fight deeply to improve it, but we are not really successful. We have very few hours of teaching on that. That's why I think the sheets are very useful to improve the level, because they are science-based and they are also labeled by association. So the GP are confident with the content. And as you said, there is so many information everywhere with very not so trustable. So I think it's very important. But what has been said during the discussion is that training is major, as the primary teaching is low level for the GP and for even the specialist. So training is important, and what has been said also, we need to train a team with different roles, the pediatrician, the GP, but also the nurses and so on. And we have a question from the audience about the pharmacists. Do we think that the pharmacists have the role? I think it's also a very important role in the promotion of a good message, a science-based message. So I think it's part of the discussion with the second question. So maybe if someone wants a comment about this first question. No, so we can move to the second question. The second question is how to optimize the program. So I think we have a lot of ideas because it was a part of the discussion now. There is sub-question I will ask you. Do you think it's with new practical sheets that we have to create? Do we think that we need to involve other health professionals? I think we need. Maybe the pharmacist, so we have thought that, multi-professional, how we can unite the community of the doctors about prevention through food. Prevention, sometimes GPs are so busy that they have no time for prevention. And prevention, it's changing lifestyles, but also it's food. And when you speak about food, you need time. You need time to explain how to find the food, how to cook the food, how to help your kids to like all type of food. So it takes time, and time is a major problem, I think, for the GP. So how we can help for that? How we can do? And also, can we do something about training program in the medical education? As I say, on the academic point of view, we have very, very low numbers of hours devoted to nutrition and generally to prevention. So it's a pity. We try to improve it in France with a new program now for prevention, but we need more. So maybe we can have also a way of training with now the new ways of communication and with different partnerships and how to extend. So a lot of questions, how to continue the program and to improve it. So we need to have your feedback on that, and we can start by the WONCA. Maybe Cassia could comment, Hannah. Who wants to comment? Cassia first.
Okay, thank you very much. So a lot of very interesting questions. I was thinking about some ideas actually for improvement. And to start with, I agree with Raluca that the materials which were shared were very useful. The topics covered were great. Maybe here now we could go more towards the mobile application, like more digital material sheets for our patients. As we know now, we are all more fluent, and we all can use the online platforms, and I think also our kids, as a lot of online studying is happening all over the world, are more familiar with online world. So I think that's an opportunity that due to COVID we have, that we can and we should use it, as a huge part of our kids' life now is happening on internet, and we've already noticed that some other companies not necessarily are using this in a good way, right? So we should also promote, we mainly should promote this healthy lifestyle and a good diet also online. My other proposal would be translating some parts of these materials into maybe more local languages. We here in Poland, not many of our patients will understand English or French well. And if we could have maybe more materials to share with our patients in Polish, that would be more effective. And it's not only for our patients, but also, for example, nurses. This is not very common to be fluent in English in Poland, unfortunately. So some of these materials, they are very good, but not necessarily we can directly use them for our patients on everyday basis. And I'm pretty sure that's not only Polish situation, but many countries in Europe are having this this problem. We should obviously think about promoting these materials that are greatly done. Also, I really like the website, and all the pictures are nicely done on the Aprifel website. So it's really eye-catching. I think it should be more promoted kind of everywhere now, just to influence our patients' awareness, but not only consciously, but also subconsciously. If you look at those apples and oranges everywhere, you see them as posters and also e-posters. You subconsciously, want to eat it, right? So also it works for kids. If we could have, like posters and in our clinics and in our online classes, I think that would be good. With targeting other professionals, I completely agree. Like we in family medicine, we work as a team. If you don't, it won't work. So the joint responsibility, the common goal, we have the same goal here. And our nurses, our nutritionists, our medical students, whoever is in your team, in your practice, should have the same strategy. So it's common, and it's the same strategy, and patients, they feel it. And I think here we do have a lot of problems with pharmacists, because what they mostly do, they promote the supplements of diets just to sell it, just to earn it. We are in Poland, one of the countries, or the top users of supplements of diets in Europe. And this is not going to be easy to achieve. But also I completely agree, education here, it must be done through the education. So this would probably change the attitude in Poland if we convince our pharmacists to change their strategy also. Because most of the times what we see is that they are encouraging our patients to buy a tablet or a powder instead of a fruit, pretty much. Well, I know that there are some ideas about the prescription for fruits and veggies. I think it depends on the country, and I think it depends, how it is done. But I would say that maybe in my country it would work too. Like, why? Because people love prescriptions. They believe that if you give them the prescription, it means that that you write something which is important, and it's the most important thing. It's fruits and veggies, and I can print it and you can have it in a colorful sheet. But you bring this back home and you say, okay, that was my doctor's recommendation. That's what I should do, right? So maybe in a, like funny way, but just to have something so they can go home and think about it again, instead of buying another supplement of diet or something even worse. How to unite the community of doctors? Yes, we as family doctors, we are responsible for prevention and health promotion. We need to find time for this. I know it's not easy, and I know many doctors are struggling with this, but we can have some strategies here. And for example, we are lacking nutritionists and dietitians here, but we are seeing the hope, and we are really working closely with our medical students. They do have more time. They need more time with our patients. So we, through the students, we organize some working groups for our patients, so they can discuss the, the healthy diet and the recommendations. We do it online now, and I think again that's something that we should use now to create some online societies working and talking about this this health diet and promotion of it. Can I add a little bit more to that? I was also thinking about like seeing the perspective from my patients who are kids. They like all these actions, like, now in the schools, they try to make it attractive. Attractive would be maybe like an apple day or an apple week or a vegetable week, or, so we can discuss more about this concrete vegetable. We could present some maybe recipes that people could use this fruit or vegetable in, and we may think about some layouts or some covers on the Facebook or some other social media that people can use, so to promote this, this vegetable or this action. I think this is where people are getting information now from. There is a lot of fake news and a lot of not necessary, well-prepared material. So for our audience, for our patients, I think that we should reach this platforms too, and be there and be active there in an attractive way for our patients. Yes, I believe that universities should be involved for sure. We do have the obligatory program for our students here, which is the obligatory course that we have during while the family medicine course, that they need to do, and they need to talk. These are the kind of workshops that we have about the fruits and veggies. But I think that it could be more common. Like, it's Jagiellonian University. I'm pretty sure that nothing like this is happening in other universities. Why don't we make it more common? Why don't we maybe even prepare some workshops that can be used, so there is not that much effort to be put by other teachers just to have it's ready for them, So again, my students are very willing to do those things. They are very good at this. They know, they're younger, they have the connection with younger people too. I think they know how to use the internet and online tools very well. So, and this is part of their work too. They will speak with patients. They need to find them the good contact with them. So again, I think that if we prepare maybe some proposals how to conduct those workshops, it could be maybe easier for others to just contact them and have them, the universities, but also for schools. We do have also the one for school and online. Again, it's easy now. We just need to have the date, and many classes can join us. And this is very popular. This is something different, more interesting. And kids they really want to be involved. So yeah, so there are a lot of I think ideas that we can use, and I'm pretty happy that I'm here and I can be involved in that. Thank you.
Thank you, Kasia. A lot of ideas. I just try to summarize, because at the end we need to build a new program. So I think you have said that you need also material for patient, because the sheet were for the practitioner. So we need material for the patient, and it could be digital, and it has to be in the language, the country language. I completely agree. This material for the patient, you also say we need to have have more funny action. We need to have the Apple Day, the Fruit and Vegetable Week, and so on. That it could be very, very interesting. And you also say that the GP could have a prescription of food and vegetable. And I think that's a good idea, because I use it for a physical activity. I make prescription for that, but I've not done just speaking with the patient, but not writing on my prescription. So I think it's a good idea. So there is something to do for the patient directly with them, and there is things to do for training for professional. And for professional, what I've noticed that you want to have action with the different professionals involved, including the pharmacist, but maybe they have to sell fruit and vegetables. I don't know, but you emphasize on the role of the pharmacist, and that we have to be all together with the same goal, and that's very important. So we need to think about training professional in the same way, making a team in the same direction. I think very important. And finally, and it's answering, because we have some discussion on the chat, and you answer most of the question. One question was why the program has not worked with the university to change the teaching of the medical doctors. So you have very nice answer. Your university is doing that, and you propose also to share workshops that could be done in different university, different school. There is another question about elementary schools and how we can have also teaching nutrition, maybe by nutrition specialists in the elementary schools. So that could be also a way for the dissemination of the program. And I think you have answered to the question of the audience. That's very great. So we just notice your ideas, and maybe at the end we need to have the new program. I think that Anna wants also to make some comments.
Yeah, again, a lot of interesting ideas. And okay, let me comment on a few of them. Speaking digital tools and tools for the patients. The market is flooded with digital tools these days, and there are a lot of very enthusiastic stakeholders, first of all, financial stakeholders. What we often see lacking is healthcare workers and patients or users' influence on the creation of the tools, the implementation, and not least the evaluation. Because we are eager to implement things, to create things, and to introduce them. But we often forget the evaluation. So that's just to be aware of that. On the team, I commented on that in the last round, and can just repeat the importance of understanding and having the same mandate. When it comes to pharmacists, pharmacists are a very diverse group. And I will not expect from pharmacists in pharmacies, if you look at the trend throughout Europe with very strong monopolies, I would almost say, with the pharmacy chains, that I would not expect, and I'm not speaking now, I'm not suspicious or condescending, but that the pharmacists in many pharmacies will say, I'm not spending time on things which will not give a revenue or income for the pharmacy. Another group is the community pharmacists, which you have these groups in many countries. And that's actually another role. We have to look at roles again and understand who is actually paying us in the roles we are holding. And that is, again, often uncomfortable to discuss, because it adds an element of suspicion or something into the discussion. We need to discuss it. Then my last point, it's often interesting to hear people having assumptions about yourself or your own group. Like, for example, having little time for prevention. What do we mean with prevention? Do we need prevention to be something we can tick off in the box? Again, this is meant constructively, like, for example, using a sheet or introducing a tool. I can give you another example. If I'm seeing a patient, or a patient comes to see me with low back pain, and I know from what the patient says that this is due to this and that, the best treatment here would be exercise, and the best prevention would at least be exercise, right? So I will, depending on who he or she is, I will do this and that in the consultation. Sometimes the prescription of medication, sometimes I will examine the patient lengthy, sometimes not, because I know him or her. But the most important thing I can provide that patient with is, if you want to avoid this, I can give you a couple of good advices. This is prevention, but it's not ticked off in the box. So to me, high quality family medicine, comprehensive medical care, always includes prevention. But sometimes it's simply not the golden moment. But if we have the teams working in accordance with the same values and understanding again a role, the likelihood of the golden moment to appear increases, right? Because we are more people seeing the same patient, and yes, here it was. Now is the time to do this explicitly. But I think we're doing it implicitly, and that is harder to evaluate. So, all from me for now.
Thank you, Anna. We remember we need to have action, but to evaluate it. So that's very important. But it's also time-consuming, money-consuming. But it's so important, because if we don't know the result of what we are doing, it's a waste of time and energy. So we have to put that on the program, how to evaluate it. That's very
May I just add, for the prescription, I'd like to come back to that maybe later, or under the third headline.
Go on.
Or would you like me to do it now?
Yes.
Yeah. Actually, we did this in Norway 25 years ago. It was introduced, the green prescription, even with an incentive for the GP to prescribe diet changes, physical activity, and in written. It was even a form. It never came into use, despite the financial incentive. And read me right, that often works, even if it doesn't give an outcome on health, if you introduce incentives. And we could, and it relates to what I just said about how are these things working. I don't think we lack so much knowledge and information, but the pedagogic skills, how to do it. I haven't seen anyone coming up with the prescription or the recipe, because I mean, if you ask people to change, food and eating is about identity, belonging, all these things. So to me, to just ask people to change because for health issues, if they are not really sick and see that this is actually going completely in the wrong direction, it can be compared to ask people to change their dressing style, or to start make use of makeup if you never used a lipstick or mascara, and say, and this is good for your health. It doesn't work that way. So again, understanding how to not target, that will be but to reach,
to find
a patient or a family on an emotional level, which does not induce shame, for example, and make them next time hide what they're doing to you because they are following your advice. So it's the same we have to ask, why are people not compliant to our advice? Why are doctors not compliant?
Yeah.
And there are reasons for it, and that is where we have to look.
Thank you, Anna. Thank you, Anna. So I add to the training the professional to have the pedagogic skill also, of course. Maybe now we can turn to the pediatrician and it answers to a question from the audience about is there any tools or a sheet for the kids? So I think we have some sheets for the pediatrician and we need tools for the kids. So Marie-Laure, I can give you the floor for answering to the different questions, how to optimize the program now with the pediatrician view.
Okay, if you don't mind, I'll let Andrea start because we had decided that he would introduce the topic.
First, no problem. Andrea.
Okay. Well, let me say that I totally agree with the ideas that the WONCA's members pressed, but totally, I really subscribe all of them. As for the involvement of pharmacists, I would add to what they said my knowledge about the south of Europe, some countries that I know a little bit better than the ones in the north of Europe, like Greece, Italy, Spain, and Portugal. And the situation is the same as it was already described. I mean, they really want to have a revenue, they want to have an economic advantage in what they are doing, and they have no interest in promoting healthy foods because they cannot sell it. Well, let me joke a little bit about that. It's like asking a car vendor to promote shoes and walking. I mean, they simply don't do that. It's not their mission in life. As for the sheets, absolutely. Again, I absolutely agree that we need sheets for patients and for kids. In our case, of pediatrician, especially for families. Digital, yes, digital is important, and social media are.
We are losing you, Andrea. Maybe Marie-Laure, you can.
Yes.
Andrea will try to connect again.
Yes. Well, I basically agree with what Andrea was saying. What my point of view is that I'm stricken by the fact that many people who are trying to find information about nutrition are facing an information which is split into small different pieces, such as the interest of vegetables, the interest of dairies, the interest of this or that, or according to age and so on. But they really lack a synthetic view of what the logic of nutrition is and how it changes over age. And I think that more fights come from the lack of crossing fields. And what I feel that what should be taught right now is really the logic behind the choices we propose. And for example, in the e-modules we developed together with the World Obesity Federation for the module of nutrition, our main focus was to give people the keys of the way of thinking that should help them, starting with an apparent nutrition problem, which is an obese child, to say whether this has to be treated through nutrition or through other ways than nutrition. And unlike you give these keys, you are just showing part of the answers to a problem which is not very well settled at the beginning. So my proposal is really to improve the tools which are available, to privilege as much as possible the face-to-face teaching, because it's much, I think it's warmer, it's better, and of course to use other digital tools, and to give really the awareness that there is, I'm very much, you know, I like this word of logic within one field. What do you mean when you speak of vegetable versus fruits? What do you mean when you speak of a category of protein versus another one? And I think that people are really now many times facing, because of this big amount of knowledge, two different problems. One, which is they think in terms of binary answers, either you are for something or against something, or you know it or you don't know it, and then there is a moral judgment behind that. And on the other hand, there are so many information that seem to be equal that you don't know which one to choose. And I think that when we deliver a program of teaching modules, we have to avoid these two pitfalls and really recenter what we say to the fact that we give more shadows to that. We give more information which is reliable and which allows real choices and real understanding of what we are doing.
Thank you, Milo. So your advice will be for the tools. We need some tools for kids, but your idea is that you have first to have this face-to-face interview, and then you can show the tools and they could have it after. Is it something like that you are thinking about?
Yes, I'm thinking like that, and for me, the most important point is to reformulate what nutrition means.
Okay, so the tools could be an addition, but after a discussion with the patient.
Yes.
I think we have Andrea again.
Yes, I'm sorry, I have some troubles with the connection.
There is an echo now. Okay, go on. But put your microphone on. Your microphone is off.
Now?
It's okay.
Yes, okay. Sorry, I had to skip to my mobile phone trying to have a better connection. Anyway, I don't know where you lost me. I was speaking about what to do.
You were speaking about we need sheet for patient and for family, and we can use social media.
Yes, exactly, and also if we choose for for other way of advertising, it should be probably done in public places. I mean, not only closed in the private practice or public practice of doctors. It can be in buses, in metros, at the stops, wherever. There is probably a very easy way to understand where to put such adverts, which is, where do companies put theirs? They already made the marketing thing. It's not to us to double the efforts to get probably the same results. So if we see that there is a big company advert in one place, probably that's the best place to put our advert. Okay, might even be side by side. It is not important that it's one to cover the other. Yes, it is a struggle, but it does not to be like, let me say, like in the United States in these days. Okay, many things have already been said about the involvement of our health professional. I would only suggest to understand that the health professionals around Europe are differently organized, and every country has probably a different system. So, for instance, we in Italy have a professional figure that is probably unique at the moment, which is the public pediatrician. I mean, every child from the birth to an age that can vary from 6 up to 14 years has his or her own pediatrician. So what the GPs do in other countries, we do in Italy as pediatricians. Okay.
You have a lot of pediatricians in Italy?
Yes.
Okay.
Yes, really a lot. Yeah.
It's quite different.
Yes, it is quite different. I think that we are around 600,000 maybe around Italy, or even more. So it is an important figure in the life of the child and of the family. Okay, but what I think Anna was saying is that we have to raise the awareness of the doctors. Doesn't matter if they are pediatricians or GPs, but they have the knowledge, but they don't know how to teach what they know. So the pedagogic skills have to be improved, and they must be aware that when they are speaking of healthy food, of a healthy lifestyle, they are actually making a prescription. If they are not aware of that, it is impossible to transfer that to the patients and families, because it comes like an advice that my uncle could say, not something that a doctor prescribe as the best way and the easiest way to get a healthy life. And well, what else? I couldn't catch all what Mary-Laure was saying, but we discussed it before, so I think that she covered probably already the points that we have discussed together. I don't know, how the other point you raised was how to unite the community of doctors around. Well, I think that probably Daniel would reply better than me, being the president of the ECOG at the moment. And because I think that the participation of the scientific societies around Europe is one of the most important points. I don't know, Daniel, if you want to step in and say something.
Thank you, Andrea. Thank you. Daniel?
Yes. I would like to comment on Anna's point of view. It is so important that we integrate the knowledge into primary healthcare, be it as a pediatrician, be it as a GP. And that means that nutrition knowledge has to be deeply rooted in the medical curricular. Lifespan medicine needs to have a clear structured nutrition element and nutrition elements. So when a young doctor moves into the field of pediatrics or general, as a general physician, he has to have the understanding, because only then he or she will be liaising with other disciplines, and he will use, as you say, Anna, the golden moment, and he will identify the golden moment or wait for a week or for the next chance. So having said that, I think what we could do is liaise and partner with the Association of Medical Universities in Europe, for example, in an attempt to harmonize curricular. This is actually happening right now in Austria, that we are actually doing exactly that in order to get nutrition knowledge and competence into the curricula of all the universities. And if this could include cooking sessions with our students, that would be fantastic. They love it. Practical hand-on skills need to be included. Point one. Point two, if we have the golden moment in any place, it is our position as doctors to use that. And our patients trust us, and that is so important. If we develop digital versions of the fact sheets, that's good, and we need it, but it has to come alongside our clear prescriptions. And if Dr. Stavdal hands over whatever, be it a fact sheet in paper or sends a WhatsApp message or has something on her website, that has another impact than if it is just on Facebook by someone else. So the combination of the competent doctor and a solid information in a toolbox that is tailored to the needs, 5 minutes, the most important info for the weaning period, 5 minutes for the preschooler or schooler, 5 minutes for the adolescent. So we need to create tools for the respective situation.
We lose you, Daniel, sorry. We can't hear you. I don't know why. Okay. We have some trouble. We lose Daniel. Maybe we can move to Jean-Michel for the scientific committee.
Yes, thank you, Martin. I have some points and some ideas about improving the action of this program. 5 points. So the first point is to repeat, because the best way to improve knowledge and behavior is to repeat. And we have to repeat for general practitioners because they can forget some messages. The first point. The second point is to add new professionals, because GP are not the only one that the population consult. We have to have a new professional such as nurses, of course, because nurses are very important in the relationship with the patients. They are very near from them. To add also new professional as a pharmacist, we have said already. Also professional which are in social centers, because we discussed we will discuss of that later, but low-income population are very in difficulty for the nutrition. And also to have a new professionals such as laboratories, of course, with some sheets which are given to them. But perhaps also to have new tools and new tools for communication, with small training sessions through video, which are very easy to look and to for learning. small video, small session, learning session. I think it would be useful for nurses and so on. The third point is to have a new target population, because when you look at the patients of GP, it's mainly old people. And when you look at the consumption of fruits and vegetables, old people have the best, the highest consumption of fruits and vegetables. But we know in France that in young population, in students, in adolescents, the consumption of fruits and vegetables is very, very low. So we have to have a new target population and to have action in university, in schools, and so on, because they have a very low fruit and vegetable consumption. But I will be prudent, cautious for the manner of to conduct education. I think now, because I have a great experience in education for nutrition. I think that nutritional education is not very good, which have to go through dietary and food education, because we don't eat nutrients, we eat foods, we eat meals, and I think it's quite important to be very close to the needs of the population. For instance, in schools, to have a session for cooking, because we begin by the preparation and the cook of food. I think it's better to have a theoretical abstract knowledge. It's the third point. The fourth point is to improve our messages. The message must be always positive, not negative. There is too much negative communication in nutrition with fears and one of the difficulty for fruits and vegetables, for instance, is that population thinks that there is pesticides in fruits and vegetables, or it's not true. The level is very low, and there is a big security when you eat fruits and vegetables. But it's always a negative idea in the population. So we have to be positive. Is the first. Secondly, perhaps to have messages which are more adapted to the specific dietary habits, and particularly the specific vegetables habits, because it's not the same through the countries. In the north of Europe or the south of Europe, it's not exactly the same. So I think that the sheets could be more adapted to the specific dietary habits and specific vegetables, and also to have messages which are more and more practiced with training on cooking and the preparation of the vegetables, because a lot of people do not know exactly how to do what to do with vegetables. They have vegetables in their kitchen, but how to use it. So I think we have to be very practiced. And the fifth, the last one, is to take into consideration on more and more other factors which are involved in food choice, and particularly psychological factors, sociological factors and economic factors, because the knowledge is not the only one factor which conduct the passion of the population of the people to choose foods. There are also many other factors, behavior and sociological and psychological factors, and we have to take them into consideration more and more. I think it can improve our impact on nutrition and on health.
Thank you, Jean-Michel. Elio, do you have some questions from the audience or from yourself?
Well, I think we have addressed most of the questions coming from the audience, and the last one was again on the role of pharmacists and pharmacy in general. And with the help of Natalie and our colleagues, I would like to show you one slide. Can you put on the slide? Thank you. So, obviously, when we say pharmacy, we address a very wide variety of locations and people and relationships between, the clients or the patients, whatever you want to call it, and the people working in the pharmacy. Now, I live in London, so in a 10 million people city with a lot of turnover. The turnover of the employees in the pharmacy is huge, but and we generally have this nostalgia of what it used to be in the old days. And I can say, for example, when I travel to Italy, where I'm from, I have the pharmacy. Let's say that I know because it's where I used to live, and I know the pharmacist, and the same people have been there for the past 30 years. That's great. But in London, the employees of the pharmacy change every 3 months. It's amazing. So the Food Standard Agency had one number of ideas. I mean, one was to promote healthy foods in a city where a lot of people when there is no COVID, clearly, consume their lunch by buying a snack. So that is the most common way of eating in London at lunch, is not sitting in a restaurant French style with a 3-course lunch, is pick up a snack and carry on. Now, Boots, which as you know is a huge chain, engaged a few years ago in the campaign very successfully of proposing healthy meals. So basically, you now in the large Boots pharmacy, you can walk in and get a fruit salad, get a mixed salad, a carrot, coriander, falafel salad, mango, fresh fruit. And in addition, the Food Standard Agency does the regular microbiological check of quality of food, and it appears that sandwiches and salads sold by this pharmacy have among the best standard compared to, for example, restaurants. So I'm not saying that this is what should be done, but perhaps in a modern society with a lot of young people who would be unlikely to read guidelines printed in a GP surgery, but they would be certainly interested in what is on the market. So I know that we all like the personal contact. We all like the idea that the pharmacist gives good advice and you are listening. But in a situation where everybody is rushing, we should also, for promoting a healthy diet, consider the opportunities rather than the, let's say, the limitations of a new distribution system where maybe very specific of UK, where pharmacies actually sell food. There was a joke a moment ago about you can't prescribe vegetables because pharmacy don't sell vegetables. Just I wanted to bring this to your attention as something that we usually don't think until when you see it. And as I said, this has had the blessing and the support of the Food Standard Agency. So new words and new ideas.
We don't have this kind of pharmacy in France, but I think it's a way to go. Thank you. And it's
well, I was saying it because we are going to talk about enlarging to other countries. So, if we enlarge to other countries, we have to go beyond what we see in a particular country.
That's very interesting. We have a final question from the audience. That is about who is the best to have health promotion, because they say that prevention, health prevention given by medical doctors is always towards disease, and maybe general prevention could be done by others with a different kind of message, most about pleasure and emotion. I don't know who wants to answer to this question, but
I'm jumping on it. This is an assumption. Where does this assumption come from? I mean, diet, advice and counseling always is directed to disease. Where does this come from?
That's a general opinion, but I think we have to fight against this general opinion. Okay, thank you. So I think we are at the end of this second question. I just want to summarize. I think we have spoken about 3 different levels. So it's very important for the future of the program. We have the level of the medical curriculum, and I think we have a lot to do, and I like the ideas of Daniel that we can record some 5 minutes about how to do in kids, in newborn, and so on and so on. We need really to improve the level in nutrition in the medical curriculum, I will agree if we can do that broadly in Europe, but we will need a lot of effort because we have to find with all the discipline, and also it's a change in the way we teach medicine. It's most curative medicine, and we have to go to a more global idea of what is medicine. So the first target could be the medical curriculum. The second target could be globally the professional. And it should be multidisciplinary, including, of course, MDs, but nurses, pharmacists. Also, I've listened to social centers and all the people that are working with the patient, and also in general with population. So we need to have training tools towards this professional going in the same way with the same languages. And that's a second level. And the third level, of course, is for the patient or for the general population. And we have different type of target, as Jean-Michel says. We need also not only to focus on all people, but also on new generation. And I've listened to Marie-Laure and Jean-Michel. Maybe what is important is to explain what is nutrition and what is concretely nutrition, and to have practical skills. Many people say we need to have cooking lessons to have practical skills. So we need to try to find the best way to go directly to the patient or to the general population, of course through digital, but maybe also things like a campaign with Apple Days and so on. So I think we have said that after this question, we have 5-minute breaks in order to have all you want to do, and then we move to the final with the third question. So 5-minute breaks. It's 11:34, so 5 will be a quarter to noon.
Yeah, and please, everybody should remain